Good morning. This is Dr. Rachel Mandel. Welcome to our town hall on vaccine hesitancy in rural Maryland. Before we get started, and while we're waiting for more attendees to come on board, we've got a poll that we'd like to share with you that gives us an idea about what questions you have or what concerns you have and just how much hesitancy you're interacting with regarding the vaccine in the community. While the poll is up, and there it is, are you or someone you know still on the fence about the vaccine? While you're taking that poll and while we're tabulating the results, I've got a little bit of housekeeping to do. First, you have the option to have closed captioning today. To find this function, go to the bottom of the screen and click on the CC icon or the closed caption icon and click Enable. The Q&A feature is active, so if you have any questions during this event, please submit them there. If we do not get to your question today, we will respond by email within 3 business days. Finally, this session is being recorded and we'll be sharing it after this event. I'd like to take a moment to acknowledge our 2 sponsors, and I will be reading some of this material, please forgive me, because I want to get it right. First is the Asian American Center of Frederick, which provides vital services to assist lower income minority and immigrant groups reach their full potential through access to health insurance, interpreter translation services, English as a second language and citizenship classes, mentoring, housing, education, employment, and business development navigation. The Asian American Center invests in the health of the community through a variety of ways, including a certificate-based training program for community health workers. Community health workers, also known as CHWs, are frontline public health workers who understand and have strong relationships in their community, and this is extremely important. The program is the first of its kind in Frederick County. AACF, the Asian American Center of Frederick, also hosts a variety of events to include free monthly Smart Moms and Healthy Baby programs. These gatherings are for pregnant women where many important topics of interest are discussed. And at the end of each event, AACF raffles off essential baby items to include clothing and diapers. Who doesn't need those? CareFirst, the other host of this event, is proud to support the work of the Asian American Center and community partners in Western Maryland. Since the beginning of the pandemic, CareFirst has committed over $8 million to address the health, economic, and social needs of communities most impacted by COVID-19. Okay, how are we doing with the poll? Do we have those results? "67% of you said that yes, you do know somebody who is on the fence still about the vaccine, or maybe even yourself. So that's a pretty significant number. This doesn't really surprise us given some other things that we know and why this is such an important topic. For example, we know that for the state of Maryland, that Maryland has posted already a 78.5% adult vaccination rate for somebody who's already gotten 1 dose of the vaccine. Frederick County, though, as of yesterday, is only at 63.5%. So the state overall is doing okay, but the county is kind of lagging behind a little bit. So that lets us know that there's definitely some hesitancy in getting vaccinated compared to the state. The other piece of data or the other statistic that we should think about is the hospitalization rate. Across the county and across the state and across the nation, we know from recent data that the overwhelming number of people who are seriously ill with COVID, who get admitted to the hospital and unfortunately even die, are unvaccinated. And that number is 99.9% of the people who are admitted with serious disease are unvaccinated. So what that tells us is that the vaccine is very safe, it's very effective, and that if you get vaccinated, you will have a 0.1 or even a 0.01% chance of being so sick that you'd have to be in the hospital. So given that kind of data, why is there still hesitancy? What kind of questions do people have? So this is the reason why we're holding this town hall. There are obviously still issues and concerns that need to be addressed. So we're here for you. We're here to answer questions. So we're going to go to the panel to address some of these questions. But first, I want to give you a little bit of background on each of our 3 panelists who are really, really experts in this field and have the ability to answer a lot of your questions. First, I want to talk to you a little bit about Dr. Julio Minical. He's a board-certified family medicine physician who's been practicing since 1985. In 2006, he decided to start a practice that focused on patients with medical assistance, many of them children of undocumented immigrants. He devotes many hours to the care of adults and elderly on Medicare, and his primary focus in his 15 plus years of practice has been the vaccination of children enrolled in the Maryland Children Health Insurance Program in Frederick County. His practice has administered over 115,000 free vaccines to the children in this community, all of them for free over the years. He was recently appointed to the state's COVID Vaccination Equity Task Force, whose mission it is to staff and run several vaccination clinics, and they've administered over 12,000 COVID vaccinations since they started during this pandemic in the state. He serves on many boards and was recently installed as the president of the Frederick County Medical Society. Welcome, Dr. Menocal. Thank you for being here.
Thank you, Rachel.
Okay. Next is Dr. Macri, Cynthia Macri. She is the chair of the board of directors for one of our sponsors, the Asian American Center of Frederick, and is the chief medical officer for EagleForce Associates, which is a big data analytics and software development company. She served over 35 years in the Navy as a gynecologic oncologist, which is a gynecology cancer specialist, in a variety of leadership roles in the National Medical Center, Walter Reed Medical Center, the Naval Medical Education and Training Command, and Uniformed Services University. Then she went to the Pentagon to serve as a special assistant to the Chief of Naval Operations for Diversity. She serves as a commissioner on the Maryland State Veterans Commission, the Montgomery County Commission on Veterans Affairs, and the Maryland Governor's Commission on Suicide Prevention. She's taken an active role in addressing public health issues that affect the Asian, immigrant, and minority communities in Maryland, and she advocates for cultural and language appropriate programs. Thank you for joining us, Dr. Macri. Last but not least is Dr. Jenny Moy. She's a board certified internal medicine physician with over 26 years experience in diagnosis, treatment, and coordination of compassionate care for diverse populations. She's also been the co-medical director of 2 nursing homes and is currently the chief medical officer for CareFirst. A native of Washington, D.C., she's a graduate of the University of Maryland Medical School and went to the internal medicine residency at Drexel University in Pennsylvania. Recently, Dr. Moy has served on an expert panel for the Organization of Chinese Americans, D.C., convened to demystify the COVID-19 vaccine with special attention to the Asian American and Pacific Islander communities. She has a special interest in outreach populations that may be at risk or at disadvantage in the fight against the pandemic. Welcome, Dr. Moy. So as you can see, we've pulled together a great deal of expertise and passion on this panel and brought it together all for you. So before we start the attendee Q&A portion, we'd like for each panelist to give us a quick introduction to themselves and their organizations and give a short overview of how their work has been impacted by the pandemic. We'd like to hear about what needs you found were magnified by the pandemic and what surprised you about either the pandemic or the response. For example, what did you have to do to pivot to respond? And remember, you've only got 3 minutes. So you'll have plenty of time to talk during the course of this town hall. But right now, we're just going to keep it short. We'll start first with Dr. Menocal.
Good morning, Rachel. Good morning, everybody. It's almost afternoon. So last year when the pandemic hit, the first issue I had was to keep our doors open and make sure we can continue to give services. At that point, a year and change ago, virtual visits or telemedicine were not paid for by Medicare or Medicaid, and 70% of my business is Medicare and Medicaid. So the first thing I did, I contacted the Secretary of Health, Dennis Schrader, and requested a meeting, and we requested a 90-day exception to that rule. And we obtained a 90-day exception to telemedicine, virtual visits, and that happened very quickly. So that allowed us to perform virtual visits on patients and hopefully get paid. We obtained permission about 8 weeks ahead of Virginia and about 12 weeks ahead of West Virginia. I don't know about Pennsylvania. The second problem we ran into was we ran out of supplies. So the biggest one was we ran out of toilet paper, and the hospital came to our rescue with that. PPE were short in supply, and so we found that through painters who brought us in their masks and let us use their masks. The third one was availability of testing kits. It it was announced in the news media proudly that people could get their dogs tested in Montgomery County. However, we didn't have enough testing kits in Frederick County to test not even Hispanics or anybody. So that kind of was a third hurdle. And then, of course, once we got all that out of the way, we figured a way to take care of patients in the office. So we put in some pretty robust protocols to provide them with the safety that if they came into the office, they would not be exposed to anybody with COVID. And that was very successful. Last came with the issue with vaccinations, and we'll get to that later. But suffice it to say that in the county of Frederick, 10.2% of the inhabitants are Hispanics, and yet 11.8% of the vaccines have gone to Hispanics in Frederick County. So I think we've done our piece well, and we met the challenge.
Thank you, Dr. Menocal. Dr. Macri?
Yeah, thank you, Dr. Mandel. It's an honor to be here. And really, Dr. Mandel, thank you for your great work in Frederick County. As you previously mentioned, I am on the board of AACF, but I'm also a resident of Montgomery County. So Dr. Menocal, I'm sorry about your pain, but I volunteer at the Pan Asian Volunteer Health Clinic as a primary care and women's health provider. But now, with the pandemic, I also serve as a vaccinator there. So it's a small clinic. It's a free clinic that provides free medical care, or for patients without any ability. If they don't have an ability to pay, we don't charge them anything. So COVID has certainly widened our scope of practice. It includes COVID testing and vaccinations, and has accelerated our outreach to a vulnerable immigrant population. Because if you look at these populations, they often have previously socialized at kind of culturally driven locations. And so these are patients from the Adult Day Healthcare Center and the Chinese Cultural Community Center, both in Gaithersburg. So we've been, we set up vaccination clinics there, outreach to the senior high rises, et cetera, to try to reach the most vulnerable populations, not just in the Chinese community, but, kind of leveraged our relationships in the among other ethnic and minority based community-based organizations. So as I'm also in retirement after I retired from the Navy, I started working at EagleForce Associates. EagleForce Health is the health subsidiary. It's a big data analytics firm. And early on in the pandemic, we were just starting to hear about it from China. We used the power of our AI, artificial intelligence, and created leveraged our application, a software application, to empower patients who are suffering from opioid use disorder to track medication adherence and other services. That was developed under a grant to Howard University College of Pharmacy and funded by the NIH. So we were able to rapidly adapt while culling information that professional journals made available to the world, so that we could look at articles, even pre-publication reports from multiple sources globally, whether it was in Indonesia or France or Germany, the UK. Obviously, China had the bulk of the publications and reports early on. And we were able to then look at how to develop a forward triage algorithm that identified more specific indicators of a likely COVID infection in the absence of available testing. And certainly at the time too, getting the test results back was an issue. So we identified early on, before the CDC website advertised it, or reported it, the loss of taste and smell was so specific to a group of infected patients. It was way more specific than something like fever, cough, and shortness of breath. So again, the power of technology does allow us to be able to impact our communities. So we rapidly adapted this technology. we're able to do symptom tracking, contact tracing, lab results, COVID testing. And the important of lab results is obviously that there has been a lot of discussion and I think evidence that poor adherence or multiple comorbid conditions, especially poorly controlled comorbid conditions, can result in a worse outcome as well. So we tracked lab results, COVID testing, COVID vaccination, access to and utilization of resources and services, and the shout out to the Asian American Center of Frederick, who identified early and addressed the social determinants of health way longer before it was a popular term. And all of these services available for people who are socially isolated, including the availability and capability of telehealth to rural and isolated populations, whether they are rural or urban. So that's basically kind of what we've been doing I've been doing basically in Montgomery, Frederick counties, and also in Northern Virginia.
Okay. Thank you very much, Dr. Macri. Very interesting. Dr. Moy?
Thank you, Dr. Mandel. I appreciate being given the opportunity to be here today and be part of this vital discussion on COVID-19 and the challenges that are faced. Quick correction, I'm actually not the Chief Medical Officer of CareFirst, but I am one of the medical directors. And I actually started at CareFirst a year ago when we were in the middle of the pandemic. And it has been really eye-opening for me to see beyond the scope of patients that I normally saw within my own practice. There are so many people in need of help because of differences in their background, whether it's language, cultural, socioeconomic, or geographic. CareFirst as an organization has addressed health disparities and vaccine inequities through a variety of different measures. We have pledged $1.2 million to invest in culturally competent vaccination education, outreach, and delivery across Maryland, DC, West Virginia, and Northern Virginia as part of the Better Together campaign. Each organization that we partner with is addressing access and equity for vaccine distribution in unique ways. The pledges that are made will ensure these organizations have the resources and infrastructure to change outcomes, not just during the pandemic, but for generations to come. For example, the United Way of the National Capital Area has expanded equitable access to COVID-19 vaccines by partnering with churches in DC and has helped host vaccination events in PG County. We were the first funder of this Choose Healthy Life initiative in the National Capital Area. Since our investment, the umbrella program of Choose Healthy Life has been awarded $9.9 million by the U.S. Department of Health and Human Services as part of a grant to expand vaccinations and make permanent the health navigators who are already doing COVID testing and vaccinations in churches. United Way is also partnering with the LIFT to remove transportation barriers for medically underserved communities by offering rides to vaccination events. Casa de Maryland is another community partner with CareFirst, working with federally qualified health centers and health systems to stand up vaccination sites targeting limited English proficient individuals, Latinx, and immigrants. This is in addition to their multilingual health hotline, which will provide 10,000 callers with referrals or navigation services for vaccinations or health and human services. West Virginia Health Right is partnering with faith-based organizations and community stakeholders to provide better access. The game changer here is that those residents will receive services at their newly established West Side Clinic, a new access point for care, a new place for social services that these pledges help to establish. Finally, through 3 rounds of funding, CareFirst has addressed the health, social, economic needs of communities with $6.8 million in support to organizations working on the front lines of COVID relief and vaccination efforts. This includes housing and food support with over 4 million meals, groceries provided, and over 2,000 people receiving housing or utility support. We hope to be able to continue to support the community's health needs throughout the pandemic and beyond.
Thank you, Dr. Moy. We appreciate all that information. So let's start getting into the questioning. And although I'll be questioning specific people and directing it in their direction, any of the panelists can also add on or give their viewpoint on that particular question. I'd like to start with Dr. Menocal. This is kind of the meat of the matter. How have you reached your patients who have been hesitant to receive the vaccine? What approach do you take?
Thank you, Rachel. I think the issue has been making sure that the vaccines were available to them. And we started that process as early as May of last year when the first directive came out of the health department, identifying what the requirements were going to be able to give the vaccine. And that was to have access to Immunet and have appropriate refrigeration. So we spent a lot of time, effort, and money to make sure that we had the refrigeration necessary, all the shots necessary, et cetera, et cetera, et cetera. The second thing was that there was a lot of pent-up demand initially in the community to get the vaccine. And as of February 15th, the vaccination rates for Hispanics in Frederick County, only 1% of the vaccines had been administered to Hispanics. So we make sure we staff the clinic appropriately. We ran a separate vaccination clinic, and we were doing about 200, 250 vaccines per day at a very quick pace. The third is there was a lot of fear from undocumented immigrants to provide documentation or ID. That kind of led to a infamous spat I had with local law enforcement, where I asked them to go a little easy in some of their immigration enforcement activities, and they agreed. But what we told patients were that we did not require a photo ID. We did not require social security numbers. We didn't even require them to provide us with their correct name. As long as when they came back for the second vaccine, it was the same name as the first time. And that was very successful, knowing that they would not be, quote, reported or not reported to any immigration authorities. And it took off. It was like we lit something on fire. Then we went to the Home Depot, vaccinated people in the Home Depot parking lot. We went under the bridges and didn't find anybody at that point that was staying there anymore. They already left. And it's been mostly make sure the vaccine is available. One of the issues was cost. And I work with a group where it's required that we charge for the vaccine administration. Of course, the vaccine cannot be charged for. And routinely, a lot of these vaccination administrations were waived so that people will get their shots. And last but not least, now we're in the kind of on the last phase of this vaccination push, where there's a lot of fear, unfounded fears driven by misinformation on the internet about what this vaccine can do to people. And there are two issues. The first one is, for some reason in the Hispanic community, they think that the government is putting a chip inside the vaccine to track them. And then the second one is that after 5 years of receiving the vaccine, people will die suddenly for no good reason. And we've spent a lot of time one-on-one with these patients. We bring them into the office and we dispel these rumors, and we'll make sure we tell them that the vaccine they're getting administered is the same one we have received personally. But it's called the ground game, and that's going to take another year and a half of relationships that you build with patients over the years, will be successful in breaking down those barriers and getting these shots administered. The other population that is kind of the teenagers. Pfizer is approved. My problem with Pfizer vaccines is it's not, you cannot just get 100 vaccines. You have to get multiples of 150, which makes storage an issue, makes refrigeration an issue. And of course, there's wastage issues. There's a rumor that in Baltimore City, where we're participating in the Vaccine Equity Task Force, this week they had to throw away 80,000 Pfizer vaccines. So until we get the EUA for Moderna, or even J&J, this is going to continue to be a simmering issue in the community.
You had talked about how this is pretty much a ground game. So you're talking to patients one-on-one. When you talk to them, how do you approach those patients who really are pretty dug in about not getting the vaccine? At what point do you just kind of move along or realize that you're
Well,
going to educate and you may not be vaccinating?
There are people that there's no question you're not going to be able to convince. I think this new surge on the Delta variant, the fact that so many of the people who are sick were not vaccinated at all has helped people to convince them to give them a shot. But a lot of times, Rachel, what you have to do is what most medical providers do, is identify the fears that have led them to believe that. And once you dissect those fears, most people understand that it's okay to receive the vaccine. We just had a mother. I don't know if you know that we provide care to all the 4-day-olds in the county that don't have insurance, and those were mostly Hispanics. And this was a 17-year-old mother and an 18-year-old sister of her who came in, and they didn't want to get the shot. But once we kind of illustrated that were they to get sick with the COVID, then the government would take over the care of their children through CPS, which is fine, by the way. Then they both that right then and there got the vaccines and free of charge. So I think we got a bunch of people vaccinated. It's going to take a while to get the rest, and we have to be patient and hold the course. I don't think mass campaigns really at this point are going to help. I think what's going to help is individual relationships with patients to dispel the fears and the concerns they have about these vaccines.
Sure, I appreciate that. There are other entities in the county that do give vaccinations with similar, I won't even say requirements, but lack of requirements for identification and ID. So if Angela, who's the coordinator for the vaccine effort for the Asian American Center, would post her information or some additional information in the Q&A for people to look at about how they can access some of those resources, especially with the health department, that would be great. I know I spend a lot of time talking to pregnant women who are concerned about their newborns. And during pregnancy, pregnant women can get vaccinated. And Dr. Macri can talk about that as well. Pregnant women, breastfeeding women, and for families where the children are not yet eligible to be vaccinated, the best thing you can do for them is to vaccinate the people around them, including their parents and their families. That's called ring vaccination, and it works very well. So it really is a community effort. So, Dr. Macri, did you want to comment on that?
Yes, and so and along those same lines, yes, the American College or American Congress of OBGYN and the American Academy of Pediatrics actually have recommended the vaccine to pregnant women, lactating women, et cetera. And you know what, I have met with a lot of people also who are vaccine hesitant, whether they're an immigrant group or they're, even college students, and young adults. And for a lot of them in the immigrant population, it's a trust issue. And the other thing that I think, Dr. Mandel, maybe you've heard too, is about the risk of disability. And one of the things that I think, I'm working with a group called the 100 Black Men of America. It's not limited to Black men, obviously, but they are the mentors and the kind of the community leaders in promoting vaccinations in large urban areas like Chicago and Atlanta, Dallas, et cetera. And we have a chapter in Prince George's County as well here in Maryland. And one of the things to talk to them about is, recently, I think last Friday, a publication came out about how men are 3 times more likely to die of COVID once they're hospitalized. And that gets attention, at places like barbershops and churches and other places where men are by and large the community leaders in those organizations. And so things like that, where fertility is an issue, or the chip, I've heard the chip thing too, but in the African American community, I hear a lot of, we don't trust the US healthcare system because it has done X, Y, and Z to us in the past. And so I think that having a little empathy and then asking, asking them to practice the standard and well-documented mitigation strategies as well. That can also kind of move them along to, so you know whether they're in the hesitant group or the militantly resistant group. There's a certain group of people that you may not be able to reach right now, but let's focus our energy and our on those and our passion on those people who are on the fence, like Dr. Mandel had in the survey, people that are on the fence, or people who may be able to be persuaded based on improving the information that's available, that is based on this big stack and big flurry of publications that are now widely available to the public.
Thank you, Dr. Macri. Before we go to Dr. Moy and talk about people's concerns about how quickly the vaccine was created, I'd like to comment that there's quite a bit of data that's been coming out, and people have been followed, pregnant women, breastfeeding women, over the last year who've gotten the vaccine. And there's absolutely no data that shows that there's any change or any problems with fertility, with cycles, with pregnancy outcomes. In fact, women who get vaccinated do the same as women who don't get vaccinated, who are healthy, but they certainly do way better than women who are pregnant and get COVID. Women who get COVID are really at higher risk of getting very, very sick, having complications with their pregnancies, potentially even losing their pregnancies. They're 22 times more likely if they're not vaccinated to have a pregnancy complication related to COVID than women who are vaccinated. So there's some real data coming out now that supports the safety of the vaccine in pregnant and breastfeeding women. And that should be very reassuring to people when they think about what they can do to keep their families healthy. Dr. Moy, if you could just address the issue about how quickly the vaccine seems to have been created and rolled out. Just kind of briefly give us an overview of what was different this time than what the typical process is for vaccine production.
This is a great question, and especially early on when the vaccine first came out, this question was probably in the forefront of many people's minds, including healthcare workers. The answer is that we had many different things working together to give us the miracle of an extremely effective vaccine in a relatively short amount of time. First, the genome of the virus was shared with us by the Chinese very early on in January of 2020. This gave us a head start since we needed this in order to manufacture the vaccines. Then our next lucky break was that the new technology that was used to make the vaccines had already been previously developed and was ready to go. Add to this that the entire world recognized the enormity and importance of this mission to make a vaccine to fight the pandemic. This meant that an unprecedented amount of resources, both money and manpower, were poured into and focused on this one problem. Drug companies no longer had to wait until one phase completed before deciding if it made financial sense to move on to the next. Things could move forward simultaneously. Finally, there was no shortage of willing volunteers to power large studies because the pandemic was affecting millions worldwide. The reason why we were able to make such an effective vaccine so quickly was because of these many factors all coming together. For anyone concerned about the safety of these vaccines, there is a system in place to track any potential adverse effects. You know that these guards in place are working and effective because periodically you'll hear about a possible concern, and you can see that these are taken seriously and addressed in a transparent way. Now, there are questions as far as if they are so safe, why haven't these vaccines been fully approved by the FDA by now? Normally, 2 months of safety data is required for emergency use authorization because most side effects happen within that time frame. In order to obtain full approval, however, usually you need 6 months of data, and it's data that includes not just experimental study-based data, but also from the real world. On top of that, all the facilities that the vaccines are manufactured in need to be inspected, and they are worldwide. A more detailed look at the manufacturing process is usually taken, and the adverse effects get looked at again at a second level. This whole process has been prioritized because of the current surge, And the hope is that the final approval may be seen as early as next month. Keep in mind that over 350 million shots have been given in the US alone and 4.3 billion shots worldwide with very minimal issues, and that's very reassuring. Many feel that this vaccine has already been tested more than other fully licensed products that are currently out there.
Thank you, Dr. Moy. Dr. Menocal, I know that some people have talked about, and this is one of the questions in the chat, about how they're concerned about the side effects and the symptoms they may get from either the first or the second dose of the vaccine, and that may cause them to lose work and then potentially lose their jobs. Have you talked to people about that? How do you manage that?
Well, that came up in our second round of vaccinations at Home Depot. I think we had like 18 undocumented immigrants who qualified for the shot, and their concern was that if they received the vaccine, they will not be able to work that day or the next day, and they want compensation for that. So I thought, oh my Lord, am I allowed to pay these people? So I asked them, well, how much do you want to get paid for a day of work? And they said, well, $30. And I said, well, would you take 10? And all of them said, yeah, we'll take $10, which kind of tells you that there's no way these guys are making, or women are making $10 a day. They're making more like 80 to 100. So they just wanted to game the system, but it cost me $140 that day. And all these people got vaccinated. So the answer to your question is $10 seems to magically cure a lot of people from their perceived apprehension to these vaccines. I don't know if I broke any laws or rules or whatever, but I figure that at the end of the day, the more people we get vaccinated, the happier everybody's going to be.
That's correct.
The other thing that we brought to their attention was that employers would and you know, I don't know if you've been to Home Depot, but they sit there and they wait for daily work. And I said, you know, most employers would probably prefer if you've been vaccinated than if you have not been vaccinated. And that was the second hook. That really was very effective in getting a lot of these people vaccinated. So the weekend after we did that, we had this gentleman show up with 22 undocumented immigrants in a van, and he requested that we pay him $20 per day, and then he would give all the people their cut. And we thought, you know, whatever, here's $220 or whatever it was, $400. Just let's get everybody vaccinated. And last but not least, we reiterated that their names will not be shared, that we encourage them to give us false names. Of course they didn't, but the fact that they knew that if they could get their shots and not be identified was very comforting to a lot of them.
Thank you. I know that there are organizations in the county that are working directly with employers so that there's understanding and communication around this issue. Certainly the health department is working with employers on these small vaccination clinics. The hospital in partnership with Asian American Center and the coordinator, Angela Spencer, are working with these organizations so that there's understanding about what the expectation is for the first shot, the second shot, and for work duties. And I agree with you. I think the largest majority of the time, the answer has been, yes, we want our people to be vaccinated so we understand what's going to happen.
Yeah, and one of the things you realize in most Hispanic immigrant communities is that in a household, you may have, for example, 8 people living in the house, and 3 may be undocumented. They might have 4 children who will qualify for services, and there's 2 or 3 that are documented. So it's not like every household is either documented or undocumented. There's a mixture. And they're very upfront about wanting to be protected against the virus. You know, I think I'm really proud of what we've done in Frederick. I think we've exceeded the expectations by about 18%. We had a lot of people coming from other parts of Maryland to get vaccinated. And that was comforting as well. But I think the most important thing is to have the vaccines available. We still have like 4,000 shots available. We keep them in the deep freeze. You can walk in and get your shot. You can do it at the time of the visit. We'll go out to your car to give you your shot, just as long. And, you know, as far as, you know, the concern we had was whether we were going to go broke or not. And we have business plans, how many patients we could afford to see for free and blah, blah, blah. And it turns out that interesting in Hispanic communities that when you vaccinate one person for free, their family members that have insurance will come in and want you to vaccinate them so you can bill their insurance for the administration fee. It's a phenomenon that is really interesting. So we made it work. I'm going to say that we're not losing money, we're not swimming in it, but we definitely paid for our costs. And last but not least, what is the future? And the future is we're going to have to keep a good 1,000 vaccines in deep freeze available at all times for vaccination. Today, we are only thawing 20 vaccines per day versus the beginning of the vaccination was more like 300. But we haven't seen any stoppage of vaccine, people interested in the vaccine.
Okay, thank you, Dr. Menocal. Who would like to address the concerns about side effects of the vaccine, specifically blood clots and potential adverse reactions if people have allergies? Dr. Macri?
Yeah, so I actually got this question a lot from a women's group that were college educated, actually at least 2 of which were nurses. And so the disinformation campaign, which is a campaign, by the way, that you can track on the internet if you with the appropriate software, you can actually track how disinformation is spread, right? It's when you open your Google account, for example, you look at and you see all these advertisements from wherever your location is, your geolocation, right? It's the same sort of thing with this disinformation. So one of the things that they said was, it's bad enough that we are hesitant or distrustful, but now the Johnson & Johnson vaccine, they had that cluster of blood clots. So the difference between the blood clots, those blood clots, and the other and regular blood clots like we have post-surgery or with pregnancy related, where your blood tends to be a little bit more viscous, those blood clots were different. And the reason for the pause, and I to them, the reason for the pause is really that they wanted to inform healthcare providers, give the healthcare providers the data so that when somebody showed up, they would use a different therapy rather than the usual IV heparin and then transition to Coumadin or whatever the current blood thinners are that people are automatically put on. So those are some of the things that I think, but the numbers are extremely small for the blood clots. It's just that it was well advertised as a cluster. And then the other thing is that the early on, they were tracking each and every adverse event that came through that was reported. And so, as you know, in the UK, in Europe, they had that one question or that one neurologic event. So again, as Dr. Moy said earlier, every one of these adverse events is looked into by the CDC or whatever the health department is in that location. So I think that we can be reassured. We can be reassured that every side effect is taken seriously and is investigated, and that the numbers will show that your risk prolonged and even fatal events from COVID far exceed those that we have seen with the vaccine. Is that fair to say, Dr. Moy?
Yes, that is. And I also want to address the question about the allergies, because I know that a lot of people are concerned, say, if they have children who are anaphylactic with peanuts and, you know, there are life-threatening reactions. And the question is, can people who have really severe allergic reactions get the vaccine? So backing up a little bit, most people have very mild reactions, if any, to the shot. You might get some redness, some swelling, you treat it with cold compresses, and you're pretty much done. A few people have a little bit more severe type symptoms where you need to sleep it off, or maybe you have a fever. Usually that's after the second shot in a 2-shot vaccine combination, like with Pfizer or Moderna. But severe allergic reactions actually are very rare. The CDC reports 11 cases in about 1 million. And of these, 71% occur within the first 15 minutes after the shot. Everyone who gets the shot is asked to wait 15 minutes regardless before leaving. For people who have a history of anaphylactic type reactions, they're actually asked to wait twice as long. And as far as like the theory, as far as what these people might be reacting to, there's comment that it more has to do with certain chemicals in the vaccine itself and not have anything to do with like peanut allergies and that kind of thing.
Okay, thank you, Dr. Moy. A little bit of information. Please look in the chat box. You'll see that there's references and some resources for you there related to childcare, to transportation, and other things that people have been asking about. So look for those links in the chat box. Just to put things in perspective related to the blood clots. Remember, it's just the J&J vaccine that there was even any question about, and your chances of getting a blood clot from getting that vaccine, because literally there have been tens of millions of doses given, is about 1 in a million or about 1.5 million. You have a greater risk of being hit by lightning. So let's just, keep it in perspective. You take more risk when you drive your car, when you go out to run your errands every day. So it's really important to stay educated on that and to understand what the context is. Dr. Moy, can you talk about, do you think we're going to need a booster?
I think most likely eventually we will, but as far as currently, I know it's being studied. I know that they feel that maybe within the next few weeks, we might need to have boosters for people who are immunosuppressed. But otherwise, it seems that we are not quite there yet as far as needing to have boosters. They've looked at how well the Moderna and the Pfizer has held up over like the past 6 months. With Pfizer, there was a drop from 94% to like 83%. Moderna actually did pretty well. It didn't drop more than, say, 1% in terms of efficacy. But the bottom line is that in terms of preventing serious disease, hospitalizations, and deaths, they're still very effective doing that. If you look at the hospitalizations, less than 95% of people who are, more than 95% of the people who are hospitalized have not been vaccinated, and less than 1% are people who have been vaccinated who might pass or have more serious consequences. So as of right now, there's no recommendation for a booster, but there may be one coming up soon.
Great. We're going to start tying up a little bit, and I'm going to ask each of the panelists, and I'm going to start first, this final question. One, what's your go-to source? Well, it's 2 questions. What's your go-to source for information that you tell your patients that they should utilize? And 2, what do you want people to take away from this conversation? What's kind of the key point that you want them to walk away with? So I'll start. Go-to sources are people in your community. There are plenty of people out there who are willing to talk to you. There are groups from the health department, from the hospital, from the city, from private practices, from all kinds of practices that are willing to discuss this with you and one-on-one even, and talk to you about your specific concerns. Utilize those resources. And what I want you to take away from this is that keep in mind that this is changing all the time, that what we knew about COVID 6 months ago is different than what we're going to know 6 months from now, and the recommendations may change. So just because it sounds like things are confusing doesn't necessarily mean people don't know what they're talking about. It just means that we have to shift with what we know. We may get a new variant that changes the recommendations. We may have new information on potential issues related to any new vaccines or any problems that'll be communicated. Science is what it is. We learn things from science, and then we have to take that information and then change our recommendations based on what we learn. So it's real important to keep that in context. Dr. Menocal, what would you like them to know, and what's your resource that you would recommend?
So I have 3 resources, Dr. Brookmeyer, Dr. Culpepper with the Frederick County Health Department. Then my biggest resource is still Dr. Howard Haft with the Maryland Department of Health. And of course, the folks we work with that Vaccine Equity Task Force, Dr. Colonel Aleli, Eric Aleli is a physician as well. I think the answer I want people to remember is that we will have these shots until this bug is dead, and that might take a while. So don't panic. You will eventually want to get the shot, and there's no ifs, ands, or buts about it. If you don't get the shot and you get sick with this, with the disease, you will not be happy. And that's pretty much it, Rachel.
Dr. Macri?
So I agree with both Dr. Mandel and Dr. Menocal on that. I think that it's also important, regardless of who your trusted source is, which community-based organizations you work with. And I think language and culture are really important in messaging, but it's also important to verify, right? So for those people who have access to the internet, and I am not so naive to think that everybody does, but for those people who have access to the internet, it is important to verify that information. And the 2 websites that I will constantly go back to, one in Maryland is COVID link, maryland.gov. And the other one is, of course, the CDC, which is still the definitive organization, federal organization for the repository of COVID information. For those people that are, at a kind of a scientific level, you can go to the core database. There's all kinds of other resources that are available. But for the trusted sources in your community, I think it's really important to verify that information and to look at what Maryland government provides for us in order to distill that information. And then the last thing, what I want people to remember is that the most vulnerable population is no longer the older people or or people with multiple medical problems. It's your children. So it's your children and your grandchildren that are not yet eligible for the vaccine, that are the vulnerable population. And they're not able to make the rules in the household about who wears a mask and who socially distance and how often you wash your hands or anything like that, even whether you go to school in classroom or in person or not. So if we vaccinate for no other reason, I think we should vaccinate to protect our children, our grandchildren, and this is the next generation. This is the future of our county and the future of our state and our nation. And I think we should not forget that is now the current most vulnerable population, the people that don't qualify for the vaccine.
Excellent point, Dr. Macri. Thank you. Dr. Moy.
I actually agree with Dr. Macri as far as the sites that I go to, the official CDC site and the official Maryland site that gives out information on COVID. As far as the takeaway points, I think the one thing to emphasize, or actually 2 things to emphasize, is first of all, it's not just the vaccine. I know we spent a lot of time talking about the vaccines, but I do want to emphasize that masks still make a difference. And especially because we have a population that is not able to be vaccinated because there is no vaccine for them, in other words, the children, then the masks become even more important. And it's good to have layers of protection. The vaccine is not perfect. There's no such thing as a perfect vaccine. That's why we see some breakthrough, and that's why some of the people, a very small amount of breakthrough patients, can still be pretty sick. So I think let's not forget about using the mask as well as the vaccines. The second thing is that a lot of times we kind of feel like, well, we'll just wait for herd immunity. We'll just let everyone else take care of the vaccine, and I'm just not going to do it. The thing to remember is that the more often the virus replicates, the more chance it has to mutate. And we have seen with the Delta how quickly it's taken over the United States as far as being over 90%, the part of the variants that is causing the COVID. But we could still be presented with a variant that's even more dangerous, even more aggressive, causing even more severe disease where antibodies and medications and all of that don't work. So the key is to try to vaccinate as much as possible, use the mask as much as possible, and to try to decrease the incidence of new variants that may be more dangerous.
Thank you, Dr. Moy. That's incredibly important information. I'd like to point out that we use the word breakthrough when we reference people who get infected after they've taken the vaccine. Keep that in mind as well, that breakthrough is actually really ends up being a success for the vaccine, because those people, although they may get COVID, are not getting seriously sick. So although they may be getting COVID, they are doing better than the people who are unvaccinated in general. So again, another way to keep things in perspective. We're getting ready to sign off. I would like to thank the panelists for their expertise, for their passion, for their time. I'd like to thank our sponsors, CareFirst and the Asian American Center of Frederick, for giving us the opportunity to discuss this. It's important what we do every day. Everybody makes a difference. Everybody on this call, everybody who's listening, and every shot in arm is to the benefit of the community. So thank you for all you do. Keep an eye out for all kinds of other types of information education in the community. And if we have not answered your question again, we will get back to you by email within 3 business days, because it's important. And we'll be posting the recorded version of this, that I also understand will have some translations in other languages as well for our minority communities and immigrant communities to be able to view. So again, thank you all. Everybody have a good day, be well, and be safe.
Thank you.
Thank you.